I'm Dr. Mark Merlin, a radiation oncologist at RC Cancer Centers. Prostate cancer is a disease where abnormal cells that originate in the prostate grow uninhibited. Sometimes it just starts in the prostate and stays in the prostate, and at other times it can spread to other parts of the body. Most of the prostate cancers that develop nowadays, we really cannot identify the cause. There are some prostate cancers that develop in families, and we see parents or grandparents that have the disease, but most of the time we cannot identify the cause. As men get older, the risk goes up, so older men are going to be the most common people to develop prostate cancer, but there are certain populations, such as the African American population, that has a higher risk than the Caucasians. All men should begin some type of screening at age 40. Usually that starts with the digital rectal exam, but at age 50, all men should begin having annual PSA levels. If you are in one of these high-risk populations, such as African American or with a family history, you should begin at age 40 or 45. The important reason to screen for prostate cancer with the digital rectal exam and the PSA is to catch the cancer early. When we catch them early, we have a much higher chance of curing patients. They'll have more treatment options, and very likely will have less side effects as a result of those treatments. The digital rectal exam is a very important part of the screening technique. There are a certain percentage of men who have a normal PSA but yet have an abnormal rectal exam and have a cancer underlying. So we still use that as a component of our screen. The PSA is also known as prostate-specific antigen, and it's a simple blood test that allows us to detect prostate cancer cells in the body. It's a very important tool that we've used now for almost 25 years, and it has allowed us to diagnose prostate cancers earlier. An elevated PSA, or a high PSA out of the normal range, does not necessarily mean that a man has prostate cancer. There are other reasons that a PSA can be elevated. The PSA test, though, has changed the way we treat prostate cancer by diagnosing patients earlier. We have seen a dramatic shift in the number of patients that are found with early prostate cancers over the past 25 years since the PSA came about. There are four main ways that we use to treat prostate cancer. First is observation or watchful waiting. Second is removal of the prostate. Third is radiation therapy. And the fourth is the usage of a medication to lower the hormone level in the body. The three surgical options are all known as radical prostatectomy. However, they're done with different techniques. The first is the traditional method with the incision on the abdomen. The other two use laparoscopes, and one uses a robot-assisted laparoscope. When using radiation therapy to manage the prostate cancer, there's two ways that we can deliver the radiation. One is internally placing some radioactive material into the prostate, and the other way is externally aiming some type of X-ray beam at the prostate. When we are using brachytherapy or placing radioactive material into the prostate, what we're trying to do is place radioactive sources immediately into the tumor, into the prostate, and trying to spare some of the surrounding tissues. When using external beam therapy, basically we're aiming X-rays from outside into the prostate. We'll call that external beam therapy, intensity modulated therapy, or there's some other types known as cyberknife, tomotherapy, or proton beam therapy. We perform a technique known as prostacision, which combines the permanent seed implant along with the external beam therapy. And what we think that does is allows us to put radioactive material into the prostate to get a good dose of radiation to the prostate, but then utilize the other form, the external therapy, to treat not just the prostate, but the tissue that surrounds it for any possible spread of the cancer. We've had a very good track record over the years. We've been performing the prostrecision technique for almost 20 years now and have treated over 13,000 men with an overall cure rate of 87%. With the surgical removal of the prostate, you are damaging some of the muscle tone, and that can lead to urinary leakage or incontinence. With radiation therapy, we don't really damage those muscles or remove any tissue, so we're generally not seeing urinary leakage as a result. The individual cure rate, or ICR, is a calculation that we perform here at RC Cancer Centers, and it's based on over 13,000 men who have been treated here over a 20-year period. Well, at the end of the calculation, you'll come up with an estimate for being cured at the end of 10 years based on real patients like you who have come here. I think this helps patients to get a realistic expectation of the likelihood of being cured. It also allows them to compare our treatment to others and try to get similar estimates so that they can make an informed decision. In managing prostate cancer patients, we have a group of patients who are curable. We have a good chance of treating them and curing them of their disease and providing them with an opportunity to have a good quality of life that follows. I use prostrecision because I think it's a very good way of attacking the cancer that's within the prostate and attacking any cancer cells that may have escaped the prostate. If you or a family member or friend has been diagnosed with prostate cancer, the most important thing is to get educated. Don't just accept the initial information that you're given. Talk to friends and family members. Try to look on the internet, read brochures and booklets to learn more about all of the different options. Eventually you'll decide which one makes the most sense for you. There are plenty of websites out there that give information about prostate cancer. One of them is curingprostatecancer.com.